So I've travelled down to Dorset to have a look round the Equine Dental Clinic. I am really excited to meet Chris and see round. Come on with me.
Hi Gillian,
Hi,
come in,
Chris.
come in.
Oh, it's good to see
nice
you.
to see you. How are you?
I'm really good.
Did you find us okay?
Yeah, it was really easy to find.
Oh, great. Okay.
Wow, I'm so impressed already.
Oh,
This
okay,
is,
thank you. Yeah, no, we've put a lot of effort into the building, and we've been open for like 18 months now.
Yes.
So it's all working, and we've had lots of clients in and everything. So.
Fabulous. This feels like a human dentist waiting room.
Well, we kind of wanted to create a really nice customer experience. So when clients come in, we want them to think, wow, this is the right place for my horse. So this is our nurse prep area, and we sort of do our preparation of surgical packs and equipment here. The nurses tend to sit here and just work on all the inpatient data and everything. That's just a little display of part of the build project there. But anyway, we'll go through now into the... So now we cross the boundary into the clinical area.
Okay.
So this is where the horses are. They'll come in from the stable block through there into this big wide corridor. And then into one of two clinical rooms, which are the dental clinics.
Okay.
And then we actually have a third one as well on the right, on the left here, which we mostly use for teaching now, but that is room for expansion for a third clinic if we need one. And we have a patient.
Amazing.
About to come in. This is Nicole.
Hi, Nicole.
Hi. She's just having a little look around.
She's having a little look around, and she's going to come in.
I love how wide your doors are and how big it is.
Well, I have to say, you know, we've been to so many practices around the UK and around the world, and we find one of the problems is that sometimes the openings are a bit restrictive. Sometimes they're not that bright, they're not that welcoming. I can honestly say we haven't had any horses that haven't just walked straight in.
Yes.
So we thought a lot about the size and the space. We were very lucky in the size of the building that we had to work with, but we thought, well, let's make it open and welcoming. We want wide corridors, we want lots of space. And touch wood, we never want any problems with any of our patients, but we are doing a large number of, you know, complex procedures, and some of these are known to have complications. We've got sedated horses. They're always a bit unpredictable, but what we wanted to make sure is that there's loads of space. Yes. Just on the off chance we needed it. So let's have a look, shall we?
Great, yes.
So yes, we've got a little bit of equipment out. It's we've got these stocks here which we had made bespoke for us. You see we've just got some we've got a hanging dental rasping unit there which we can just bring in as we need it. And then we have you'll recognise some equipment from human dentistry.
Exactly, looks the same.
Yes, so we wanted, again, it's not just to make it look like a human dentist, but we did want that feel, because dentistry historically has had a bit of a, what's the word, a bit of a grubby kind of feel to it sometimes. It can be in a field, it can be in the stable. People are not necessarily used to dentistry being done in a really high quality clinical way, and we wanted to create that environment because we think it's so important. You know, dentistry, there's so much to it. You know, it's a real clinical specialty now, and we wanted to create an environment where it was easy to do these sometimes very complex procedures.
Yes.
And the rate of advance of what we can do in teeth has been so rapid over the last 10, 15 years that what we would have needed 15 years ago is completely different to what we need now.
Yeah, absolutely.
So we've got our oroscope camera there, which we'll show in a minute. It's actually got a picture frozen from a previous patient on there. We've got a monitor here which we can connect up to all sorts of imaging, like the CT that's in the other room, X-rays. We can put those up there when we're working. We've got our dental light here, like you see in the human dentist. We've got our dental unit here with all our electric and pneumatic handpieces. So again, having electric handpieces, this is something very much which we've taken from human dentistry. Using electric handpieces, got a lot higher torque, a lot easier to use, multifunctional computerized display, so we can use it for endodontic functions, things I'm not going to bore you with, but it's a lot easier to use that style of system.
So do you always sedate all the horses?
Yes, we wouldn't even consider doing anything without sedation, absolutely 100%. Now, That's not to say you can't rasp teeth unsedated. We know there are plenty of people out there who do that on a daily basis, but we're doing something completely different. Anyway, so I set this up 10 years ago. My colleague and director partner Nicole joined 6 years ago, and yeah, we've been growing steadily ever since. We now have a third specialist up in Scotland to cover that part of the country, and it's great. We've got colleagues in Denmark, Holland, Norway, Finland, all setting up clinics very similar to this. So it does seem to be now something that's caught on, doing this style of dentistry. South America, I've lectured over there and been over there a number of times. Brazil, for example, they are absolutely crazy for this kind of dentistry. You know, there's multiple clinics sort of setting up in a similar style. So yeah. It's great. It's definitely becoming the new veterinary norm.
Yes.
And
it must feel fantastic to feel that you are making a real difference to.
Well, yes, and I think there's no doubt. You know, the main things that benefit are the horses. There's absolutely no question, and it's a for me it was a logical step. Horses are living longer because veterinary care in general is so much better. Now humans are living longer because human care is so much better, medical care, and dentistry has to keep up with that.
Yes.
Okay, so you see, she's not so sedated that she's kind of falling over. She's just sedated enough so that she doesn't really mind this kind of examination. So it's a fairly light sedation, and these drugs that we use for sedation, they're so reliable and they're so widely used for all sorts of things, for ultrasound scanning, for rectal examinations, for everything. So very, very safe, very reliable, duration of action of about half an hour to 40 minutes. Okay, so we've rinsed the mouth, we've got her on the headstand. You can see it's quite padded, so it's comfortable. Again, a lot of these things we've changed the design over the years, but anyway, I've changed to a scrub top just to keep it more clinical. And actually, although I'm wearing a headlight, I have to say I don't wear a headlight very much anymore because we use these speculum lights.
Oh, great.
And this is very thin, modern design, and that can just attach onto the top of the gag or the speculum there, and then that shines a nice light into the mouth. And this is great for clients so that they can see exactly what's going on in there, because we don't have to sort of get them to look over our shoulder. Okay, so what we can do with this network that we've got set up, very easily we can mirror the iPhone onto the screen on the wall. And again, this just gives clients a nice immersive experience. So you'll see now, without having to get the client to look over my shoulder, if you look on the wall, we can see the inside of the mouth.
Oh, great. That's really good.
Okay, so now we're looking in the mouth, and you can see we've got the image on both of these screens. In fact, we've got 3 screens that's showing the image, but the one over there is a kind of a bigger one. And there's 2 reasons behind us having these screens. One is that it's great for clients to see exactly what's going on, but it's also really nice for us when we're doing certain procedures. Sometimes we're standing on one side of the horse, we want to look across the screen that side. If we're working on the other side, we want to see it on that side. And we used to have to sort of move a screen around from one side to the other. Now we can just work with everything that we need to hand. So this is what, and I genuinely feel this is what every horse should have periodically, is this style of examination. And then treatment based on what we find.
Absolutely. This has been absolutely fascinating. Hi Nicole, it's great to see you.
Hi Gillian, lovely to see you.
So Chris has sent me through here for you to show me around this part of the clinic.
Yes, so this is our 3rd examination room. As you can see, we don't have any stocks in here,
okay,
but it is kitted out so that we can put stocks in, we can make this a dental room. You can see we've got the same TVs, we've got the taps, so we've got all the connections if we wanted to. But we decided to leave it without stocks because we first wanted to see how it works. And actually we use this room as a teaching room, so we use it when we do CPD and practical courses. It actually works really well. We put out tables and vets come and we do practical courses with them in here.
Great.
So the most important use for this room at the moment really is that we use it as our prep room for our CT scanner, which is next door.
I am so excited to see this.
So then they have to stand on this.
It's a bit wobbly.
And it is a bit wobbly, and surprisingly, actually, the horses tolerate it really, really well. I'm always really impressed.
They're used to travelling in horse boxes, aren't they? So it's pretty similar.
Exactly, yeah. And to be honest, we very rarely have horses having an issue. We do take the front bar off. We do keep the CT scanner further back. If the horses are a bit daunting, we can actually take the sides off as well, so they come in quite comfortably, and we get them standing in the box. So then the idea is the horse is nice and relaxed and sleepy, and the horse then rests his head on here.
Yeah.
And this is the gantry. So the gantry is the CT scanner. It effectively is a machine with 3 X-ray machines in it, and it literally whirs around in the horse's head and takes 500 or 600 pictures as it moves over the horse's head to build a beautiful 3D picture.
So is this one of the CT scanners that can do the neck as well as the head?
It can potentially, but we can't go very far down the neck.
Okay.
It depends on the size of the horse and also how well the horse sedates and how well the horse tolerates being in here.
Yeah.
So like I said, this table can move up and down a little bit depending on the size of the horse, but the table that you're standing on is actually a pit. So if you don't mind standing on it, you can actually see. For really tall horses, we can lower them down.
Oh, that's fantastic.
So that their neck and their heads at this point. And then for really small ponies, we can lift it up so that they can actually be on the level.
That's perfect, isn't it?
Yeah, so and once again, you know, we were worried a bit about them moving, but actually it doesn't bother them at all. Like, so I think they're used to, you know, juggling around a bit in the horse box, so they're okay.
So other CT scanners that I've seen before, it's been a case of the horse has been moving in and out of the CT scan, but this looks a bit different.
Yeah, so we're one of only 7 or 8 standing CT scanners that will do horses in the UK, which is pretty unique, and actually the only dental clinic in the world that is purely a dental clinic with our own CT scanner. So we're very proud of that.
That's amazing.
And then, yes, we actually saw this model where most of the other ones, like you say, the horse moves in and out, whereas this is where the gantry moves, and actually we felt this has a big advantage for us because obviously if the horse moves in and out, there's a risk of some movement, and when you're taking that CT scan, which takes about 45 seconds for the actual scan to take, you really want the horse standing as still as possible, and we feel that this gives us that little edge, a little bit of advantage to get us a better image. So this is our stable block.
Okay.
And we've actually got 11 stables in here. So that was one of the big things that we wanted to do when we moved from the smaller clinic to here. Our small clinic had 4 stables. And when we have a busy day, 4 stables are just not enough.
Yeah.
And also, obviously, we've got enough stables, so we've got a full day. As you can see, actually, a lot of the stables have been used today. We've had quite a busy day. We've had quite a few horses in.
Yeah.
And most of our appointments are in-out appointments. The horses come in, they work up, so you know we've never seen the horse before. They come in, they have the examination, they have the X-rays, and we actually do the procedure, the treatment at the same time, even if it's an extraction, even if it's a difficult extraction. Based on the history, we'll give ourselves enough time for the appointment. Generally, our appointments are an hour and a half. If it looks like it might be a tricky extraction, we might give ourselves a 2-hour appointment.
Everything you're doing here is so much more minimally invasive, isn't it? So then they're not staying very long.
No. So, I mean, things have advanced so much. I mean, but our knowledge and our equipment and our experience, it means that, you know, we can do these procedures a lot quicker than we used to be able to. You know, the longer we hospitalise patients, the more at risk you are of things like colitis, even just stress. You know, horses don't like being in a strange environment, so we really try and get them in and out as quickly as possible.
And I even love the artwork that they have everywhere. This is such a beautiful place. Come and see what's up here. So in here is their conference room. And Chris and Nicole, they run different training all about advancing the understanding of equine dentistry. Come and see what they're setting up in here. So Chris is in here, they're setting up a podcast suite. So they're going to be interviewing different people running podcast channel. So that's something I'm really looking forward to. Wow, what an amazing afternoon. And look, this gorgeous countryside. I absolutely love this place and I feel like I have learned so much. In fact, I feel like I've stepped into the future. I think this is what equine dentistry practices should be like across the country, and I can't wait to see it developing in the future years.